The Citizens Healthcare Oversight Committee was created to ensure the integrity of the expenditure of funds raised by the indigent healthcare sales tax. One of the committee's focuses is adverse childhood experiences and their negative impact on physical and mental health. Learn more about how recognizing the negative can lead to positive healthcare outcomes coming up on Polk Place. Hello, welcome back. I'm your host, Tricia Pichette, and with us today are Terry Saunders, the Chief Executive Officer of Heartland for Children, and April Roll, their Chief Legal Officer. Welcome and thank you for coming.
Thank you.
So why are we here today to talk about adverse child experiences and trauma-informed care?
Mm-hmm. Well, we're here to raise awareness about ACEs, or adverse childhood experiences, but we're going to refer to it as ACEs throughout this program. It's just easier to say. We need to talk about the need for prevention, the need for screening, and the interventions to help healing. That's what our community needs to know. Heartland for Children, we see the effects of childhood trauma all the time. But it's beyond child welfare. It is a public health crisis at this point. It's a national movement. Everyone wants to know about ACEs. They're understanding now more that when a person has a higher ACE score, it can relate to their health concerns. They can have problems with heart disease, they can have problems with diabetes, and that message is going across the country. And it's just great to know that Polk County is on the cutting edge of that. They understand the need to spread that message throughout the community. Terry is the child advocate for the Citizens Healthcare Oversight Committee, which is the Polk County, the
Polk County's Indigent Healthcare
Yes.
Sales Tax
Yes.
Oversight Committee.
Very long title, but a great purpose, right? She's also the chair of the Prevention, Wellness, and Access Subcommittee. And she's going to tell you a little bit more about what Polk County is doing about ACEs.
Yeah, so just to give a little bit of context and history, in 2018, the COC, we had a strategic planning retreat. And the Wellness, Prevention, and Outreach Committee had a lot of conversation around how do we shift the paradigm from just looking at health issues to prevention and wellness. And we talked a lot about some of the things that usually hit the radar screen there, your things related to obesity and mental illness, and then some of the more serious diseases that we see. And what we recognized is it would be really great to get upstream on those things and look at what are some of the underlying risk factors for all of these different disease states. And the research shows that the adverse childhood experiences really are related to over 40 different health and social outcomes. Wow. And so we wanted to put a focus on that, and one of our desired goals that came out of the strategic planning was really to have that education and awareness built up in Polk County, and to shift the paradigm so that early intervention and prevention becomes the norm. And we want to do that by focusing on education around ACEs and resiliency building. So I'm really excited that we embraced that as a strategic plan goal. And then one of the first steps that we did as a subcommittee is we worked hand in hand with the county staff, and the county was awarded a technical assistance grant from the Substance Abuse and Mental Health Services Administration, or SAMHSA. So we were able to bring in a national expert to offer training to our community on trauma-informed care. And that was a great way to start building some awareness of what the issues are, and really beginning to start to get people to think about how they can integrate this viewpoint or this paradigm into the work that they're doing. So then a next step in our process was being invited here to Polk Place and to do just kind of an educational moment about our work with that subcommittee.
So what is ACEs, and how does it benefit someone? If it's a tool, how does it work?
Right, that's a great question. So in the 1990s, the Centers for Disease Control and Prevention and Kaiser Permanente did a big research study that identified that there are leading causes or leading risk factors that are related to our childhood experiences. And so the actual ACEs screening tool is a 10-question tool, and it's screening for things that may have happened prior to 18 years of age. These are things that relate to abuse, child abuse, physical, emotional abuse, living with someone in your home who may have mental illness or an addiction, or there may be family violence. So there's actually a screening tool that assesses those adverse childhood experiences. And what that early ACEs study found was that higher exposure to those adverse experiences were linked to 7 of the 10 leading causes of death in the United States. And so we know that if we want to really start to work on those leading causes of death, we need to back things up and really work on all of the things that lead to that, so all of those adverse experiences.
So how does this test get to a patient, for example?
Right. So in different parts around the country, the ACEs screening tool has been integrated into pediatrician offices. It's been integrated into the screenings that are done at emergency rooms and primary care physicians. And really what it does is it allows that nurse or physician or even sometimes a social worker to be able to have a conversation with a patient or a parent around what may have happened to that child or to that adult, even in childhood, and how those things may be impacting their health and well-being now. And through that assessment process, then you're able to go ahead and link to other services that might be helpful in healing some of that trauma.
Interesting. So someone's negative experience might be the reason that they have diabetes, and if you address that situation, it might make it easier to treat the diabetes?
It may make it easier not just to treat the diabetes, but to help that individual improve their overall quality of life. Okay. We know from this body of research on adverse childhood experiences that those ACEs can impact brain development, they impact the immune system and the hormonal system, and also how your DNA is read and expressed. So we have to start thinking about this from an integrated perspective, right? The mind and the brain and the body are one system, and we need to be making sure that we're integrating all of that knowledge. The wonderful thing is that the CDC continued their research, and in somewhere around 2015, they published the Essentials for Childhood. And what they identified was that safe, stable, nurturing caregivers are really helpful in buffering any of that childhood stress that a child may be exposed to, and that can help to offset those negative experiences greatly. And that if we can raise awareness around that and help to build the ability of our caregivers and our parents to be safe, stable, and nurturing, then that can offset all of those traumatic experiences and help those kids to not go on to develop a lot of the diseases.
So in a perfect world, how can adopting ACEs help Polk County? Where do we start?
Well, I mean, it's best to look at it in 3 different areas. There's the prevention, there's the screening, and the intervention for healing. So that's something that anyone can remember. Mm-hmm. Let's talk about prevention. Like we've discussed, if we get in early and prevent those adverse childhood experiences, then it will help a person be healthier when they get an adult, right? Mm-hmm. So there's domestic violence courses, there's parenting courses, and I'm not talking, you don't have to be in the health care field or the mental health field. You can be a mentor to a parent. You can be a mentor to a young person. Anyone can help prevent ACEs. Then there's the screening. That is more focused on, like we talked about, the healthcare field. So the pediatricians, the urgent care, the mental health professionals, they can screen. And although the questions asked specific questions such as, did your parents experience a divorce when you were younger? Was a parent imprisoned when you were younger? Did you have any type of inappropriate touching? What the focus is how many ACEs, how many experiences have you had? Not necessarily what they were, which can be handled later, but how many? Like we discussed, if you have 4 or more, it increases the likelihood that you'll have some physical or mental health problems in the future. So there are various screenings that people can use to just alert the medical provider of these are the risks that this particular patient may be facing in the future, and then we can deal with those. So there's the screening. Then there's the intervention for healing. Now, some people have already experienced these adverse experiences, and how can we help them heal from there? How can we help the parent who may have been traumatized when they were younger be a better parent now to their child? And if we can address those 3 areas, and anyone in Polk County can do that, then we can develop a healthier and happier community. That is our ideal, a healthier and happier community. And like I stated, this is a national movement. Across the country, people are discussing this. And we need to join that movement. Each person in Polk County needs to join that movement to reach their neighbor, reach their teacher.
Well, thank you so much. That was fascinating. And thank you for joining us. We really appreciate it.
Thank you so much for having us.
Yes, thank you for having us.
Heartland for Children is a local agency for community-based care in Polk, Hardee, and Highlands County. They have assumed responsibilities for system administration of comprehensive child welfare service provider networks that include protective services, foster care, adoption, independent living, preservation, family preservation, family support services, and other related services. Currently, they are supporting the Citizens Healthcare Oversight Committee's focus on adverse childhood experiences, or ACEs, and their negative impact on physical and mental health. For more information, you can look them up on the web at www.heartlandforchildren.org or give them a call at 863-519-8900.